Hi guys, welcome to my channel. It's Sumit Kumar Khandai. So as I promised that I will just complete the syllabus. I complete the total syllabus at DPAT. First, I started with pharmacology. Before starting the pharmacology, I'm first considering who is the father of pharmacology. So the father of pharmacology, modern pharmacology, is Ostwald C. May D. Burke. C. May D. Burke. Uh, you can pronounce it more better than me. And the father of Indian pharmacology is Ramnath, not Kovind, Ramnath Chopra. You got it. So coming to the point, who pharmacology definition. So pharmacology is a branch of biology. Pharmacology is a branch of biology that deals with the study of drug action. That deals with the study of drug action. Another thing that comes to the mind, that what is drug? Yeah, it has a positive meaning and negative meaning. People always use that a drug. You are taking a drug, absolutely you are a bad person. No, no, no. It also has positive meaning in disease. In any disease, you are taking some medicine that is also a drug, also known as a drug. So, what is the definition of drug? What's the definition of drug? So, drug is a substance or material that mainly used to modify the physiological, that's used mainly for modify the physiological system or uh, modify the physiological action that for the improvement of the patient, for the betterment of the patient, or for the benefit of the patient. So it's the definition of drug. If you just consider, then there are different type of drugs. Means there is orphan drugs and essential drugs. There are prescribed drugs and other non-prescription drugs. If you just consider orphan drugs, what are the orphan drugs? Why you just consider as the orphan drugs? Mainly, the orphan drugs are the drugs that used to use for the treatment of very rare diseases. Very rare diseases. So, what are the rare diseases? Means, yeah, I'm just writing something. What are the rare diseases? Yeah, got it. The rare disease hereditary coproporphyria. That rare is hereditary copper. Mainly those rare diseases, hereditary diseases. So what are the hereditary diseases? That is the hereditary coproporphyria and variegated porphyria. Variegated porphyria. And I also consider some. Let's consider some orphan drugs. Orphan drugs. I just made a mnemonic, that is the NALEF SRD. NALEF SRD means N for nitrate, A for amphotericin B, L. L liothyramine. Liothyramine. This is liothyronine. That's liothyronine. Null F. F is fomipizole. That's F is fomipizole. Null F. SRD. S is Sima. No, Sima not. That is Suma. Sumatriptan. I just can't focus. Sumatriptan. Another one R. Another which what is the name of R? That is the rifabutin. That is rifabutin. SRD. That is digoxin antibody. So that is NALF SRT. That's the mnemonics for what? Orphan drugs. After completing this orphan drugs, I was coming to essential drugs. What are the essential drugs? Why we call it essential drugs? Why we call it essential drugs? Essential drugs are the drugs. Those that satisfy the health needs of majority of the population. Those that satisfy the health needs of majority population. If those things are getting satisfied, then we can call the drug as essential drug. So what are the characteristics, what are the properties of those essential drugs? Effective and economical. It should be effective and economical. And another is safe. It will always be safe. And another thing is single drug formulation. It will always be single drug formulation, and it should be available every time. It should be available every time. And another thing that is needed by the majority of the population is the first point. Needed by the majority of the population. So those factors should be obeyed by the essential drugs. Another thing, that is prescribed drugs. What are the prescribed drugs? There are also some drugs, but which drugs should be prescribed? Means whenever you're just going to the doctor, they always prescribe some drugs. Means you can't buy those drugs by yourself from those medicine shop. So after the permission, after the prescription, whenever you give the prescription to the medicine shop, then he will give you some medicine. So these are the prescription drugs. So what are the prescription? Prescription drugs is a pharmaceutical drug that legally requires a medical prescription. That legally requires a medical prescription to be dispensed. So what are these types of drugs? Antidepressant drugs and antibiotics. These are the drugs that should be prescribed by a licensed physician. That got it. Another one is non-prescribed drugs. What are the non-prescribed drugs? Yeah. Example is that should be not prescribed. Means you can also buy from medicine shop by your own. You don't need any prescription. Huh? So what are the examples? Antacids. Huh? Another is antacids, and another one is strepsils, paracetamol. Whenever you got a small fever, you don't think that you have to go to the physician for any treatment. So you just get paracetamol from the medicine shop. So these are the non-prescription drugs. So in this way we just compare different type of drugs. So another thing that is, what are the source of drugs? What are the source of drugs? So what are the source of drugs? Means there are also a plant source, there is animal source, another is a microorganism source, also there is a mineral source and synthetic, semi-synthetic, and also there are some drug that is produced by the genetic what is genetic engineering. They are produced from genetic engineering. What are the drugs that is obtained from plants? Alkaloids, means glycosides, and some volatile oils, and many more things that is mainly obtained from the plants. And what are the drugs that are often from animals? The animals, if you just consider heparin, and another one is insulin, and is muscone. Heparin is obtained mainly from pig and cow, and insulin also obtained from pig and cow. Insulin obtained from the pancreas of pig and cow, and heparin is obtained from what intestine or wherever there is a cow or pig. Another one is muscone. Muscone is mainly obtained from the musk deer. Musk deer. It mainly used for perfume. Mainly muscone is used mainly for perfume purpose. Another one is that is minerals. What are the minerals that is mainly used for the drug? As a drug, that is whatever that is. Let's calcium phosphate. No, magnesium sulfate, ferrous sulfate, magnesium sulfate, ferrous sulfate. Another one is lithium carbonate. Lithium carbonate. These are the drug that is mainly used uh, mineral source. Another one is from microorganisms. From microorganisms we get streptomycin, penicillin, and glycopholvins. Those are the drugs we obtain from obtain from microorganisms. Another one is synthetic. What are we getting synthetic? Synthetic one is aspirin, paracetamol, and sulfonamide. These are synthetic sources. And semi-synthetic. What are the semi-synthetic? Semi-synthetic is hydromorphine, and hydrocodone. Hydromorphine and another is hydrocodone. Another is a drug that is produced from the by means of genetic inheritance. Yeah, genetic inheritance means insulin. That is the human insulin. That is humalin. That is obtained by means of genetic engineering. Another one is that is hepatitis B. Hepatitis B vaccine. Hepatitis B vaccine is also obtained by means of this genetic engineering. So these are the things I also covered, that what are the introduction of pharmacology, and what are the different type of drugs, and what are the source of drugs. So this is for today this is, and after that I will just complete or another thing that is related to another thing of general pharmacology. Let's stop today. Let's stop for today. After that we will just